last slide, and this is at our Shady Grove campus, and these are 149 of the 150 students in our class. Not a bad looking group. Thank you very much.
Thank you very much. Dean Eddington, you have provided us with a terrific model that I'm sure many institutions, hopefully here too, will consult with you in order to establish something very similar, which clearly from the response you've already had is something that is needed across the country. Thank you very much for coming. Really much appreciated.
Sure.
Any questions for Dr. Eddington?
Thank you so much for this presentation. There are a number of ethical issues that I perceive here at the moment, and one of them is do no harm. The other is life, liberty, and pursuit of happiness. There's extensive literature in the study of human happiness, and Todd brought up a very interesting point that I caught on to, and that is the issue of aversion to an intrinsic neuronal behavior as a result of certain of the molecules associated of the derivatives of the cannabis plant. I have some degree of reservation because there are people looking at cannabis materials for recreation. And recreation that leads to death is defeating the idea of the dignity of life. I have considerable concern that we're pushing ahead with an economic force and without full reservation to the potential harm to individuals and groups within our society. Would you comment?
Yeah, so I think one thing that is very important to us at the School of Pharmacy is that we named the program Medical Cannabis for a reason. And so that's very important to us. In terms of the work that we're doing with this program, it's mainly education. You know, I was struck by the level and the amount of gaps that we have seen with healthcare providers. I have been struck by the lack of education in science programs on cannabis. So that's our focus. I believe that, so the issue for me is learning more about cannabis. The issue for me is that we need to continue to do research, but we need an educated research infrastructure as well. And so I don't know if I am answering your question. I don't think that we should step back from cannabis because of certain issues that you've mentioned. I think we need to learn more about it. We need to be able to do research, and we need to have an educated workforce in order to do that.
Arizona. I'm also a medical cannabis patient. Faster and whatnot for athletes so they can perform well on a week-to-week basis. Thank you.
Thank you.
Hello, my name is Ricardo Pareda. I'm an alumni from the University of Arizona. I'm also a medical cannabis patient, although I'm not registered with the state any longer. I'm a veteran also, received my care through the VA, or at least some of it, not the cannabis part. I think to answer your concern, sir, about the harms, we're already being harmed with what we're being prescribed already. And the gap in this knowledge base is because of our refusal to address these subjects in a professional, rational manner. And that does a lot of harm to people like me, to athletes, to other individuals who are curious about this as an alternative, a true alternative to the opiates, to the benzos, to a lot of the things that are already being consumed, abused here on campus right now, here in this hospital right now, right? We have alcohol that's served at every single game. They just expanded the liquor license. How many veterans, myself being one of them, who was self-medicating with alcohol? There are a lot of things that we need to fill in here with this educational gap, and going back to the ignorant rhetoric isn't going to assist us in finding the answers we need for the future. In my opinion, have you come across this? Because when you're emphasizing a lot, we're not studying the plant. The plant's not going to be in campus. There's a lot of things that are harmful in this campus right here that are being studied. There's a lot of things in the controlled environment research area that are being studied that are harmful. Why are we treating this plant like it's radioactive? Have there been any deaths associated with it? Have there been any diseases spread as a result of touching it or handling it? I worked with cannabis for 2 years. I didn't get anything negative as a result of my work with it. Why is there this inability of institutions outside of Ole Miss to conduct actual research? Thank you.
That's a great question, and please know that if I was allowed to do research, I would be doing research. The challenge that we have is the fact that it's still Schedule 1, and that does have a perceived impact on federal funding for universities like University of Arizona, University of Maryland, Baltimore, Johns Hopkins. I have been very active in trying to move the university where I work to do research. My background is a researcher. I have a PhD. I'm a pharmacokineticist myself. And so there are all these questions that we need to answer. You know, one of the interesting facts is that when you talk to healthcare providers that are providers of cannabis, and when I was putting this program together, I always said, so what is it that we really need? What can we focus on? And the first thing that they would always say is we need a starting dose, right? And so there isn't any research out there or enough research out there and a diverse level of research to really help with being more specific with cannabis, the components, dosing, dosage forms. And so our goal with this program is to at least work on potential researchers, clinicians, etc., that when the switch is turned on and it goes from Schedule 1 to Schedule 2, that we can start doing research and really finding out this, the therapeutic uses in a more broader sense for this exquisite plant. And so I hear what you say. I totally agree with you. I'm as frustrated as you are. But there are laws that prevent us from doing the research that we could be doing.